This is the spinalis cervicis. It is involved in extending and hyperextending the vertebrae. The origin is the spinous processes of C6, C7, T1, or T2, and the insertion is the spinous processes of the axis, C3 or C4. This is the spinalis thoracis. It is involved in extending and hyperextending the vertebrae. The origin is the spinous processes of T11 or T10 to L2 or L3. The insertion is the spinous processes of T3 or T1/T2 to T8. This is the longissimus capitis. It extends the vertebral column. It is involved in lateral flexion and rotation of the head. The origin is the articular processes of cervical and transverse processes of upper thoracic, and the insertion is the mastoid process. This is the longissimus cervicis. It is involved in extension of the vertebral column, lateral flexion, and rotation of the head. The origin is the transverse processes of the thoracic, and the insertion is the transverse processes of the lower cervical. This is the longissimus thoracis. Its function is extension of the vertebral column, lateral flexion, and rotation of the head. The origin is the sacrum and spinous processes of lumbar, and the insertion is the transverse processes of T1 to T12 and the angle of ribs 9 to 10. This is the iliocostalis cervicis. The function is lateral flexion and spine extension. The origin is the angle of ribs 3 to 6. The insertion is the transverse process of C4 to C6. This is the iliocostalis thoracis. The function is lateral flexion and spine extension. The origin is the angle of ribs 7 to 12. The insertion is the angle of ribs 1 to 6 and the transverse processes of C7. This is the iliocostalis lumborum. The function is lateral flexion and spine extension. The origin is sacral and iliac crest. The insertion is the angle of ribs 6 or 7 to 12. This is the quadratus lumborum. It extends the vertebral column and lateral flexion. The origin is the iliac crest, and the insertion is the transverse processes of L1 to L4 and rib 12. This is the external oblique. The function is lateral flexion and rotation of the torso. The origin is the 5th to 12th ribs, and the insertion is the xiphoid process, iliac crest, and pubis. This is the internal oblique. The function is lateral flexion and rotation of the torso. The origin is the iliac crest, and the insertion is the 10th to 12th ribs. This is the transverse abdominis. It pulls the abdomen in. The origin is the iliac crest and intercostal cartilage of 7th to 12th ribs, and the insertion is the xiphoid process and pubis. This is the rectus abdominis. Its function is flexion of torso. The origin is the pubis, and the insertion is the xiphoid process and costal cartilage of ribs 5 to 7. This is the diaphragm. It is involved in allowing lungs to inflate or deflate. The origin is the sternum, ribs 6 to 12, and the lumbar vertebrae. The insertion is the central tendon. This is the external intercostals. The function is to elevate ribs for inhalation. The origin is the rib superior to each intercostal muscle, and the insertion is the rib inferior to each intercostal muscle. This is the internal intercostals. The function is to depress ribs for exhalation. The origin is the rib inferior to each intercostal muscle, and the insertion is the rib superior to each intercostal muscle. This is the levator ani. It supports pelvic organs and contributes to sphincter activities of the anus and urethra. The origin is the pubis and ischium. The insertion is the coccyx, urethra, rectum, and perineum. This is the coccygeus. It supports pelvic organs. The origin is the ischium. The insertion is the coccyx and lower sacrum. This is the deep transverse perineal and the urethral sphincter of the urogenital diaphragm. It is involved in voluntary control of urination. The origin is the ischial ramus and inferior pubic ramus, and the insertion is the perineal body. This is the ischiocavernosus. The function is clitoral or penile erection. The origin is the ischial tuberosity and pubic symphysis, and the insertion is the clitoris or penis. This is the bulbospongiosus. The function is to constrict the vagina for females, expel the last urine or semen drops in males, and maintain erections. The origin is the perineum tendon, and the insertion is the clitoris in females and the penis in males. This is the superficial transverse perineal muscles. The function is to support pelvic organs. The origin is the ischial tuberosity, and the insertion is the perineum tendon. This is the external anal sphincter muscle. The function is to remain always closed and contract even tighter when needing to hold it in. The origin is the anococcygeal ligament, and the insertion is the perineal body. This is the pectoralis minor. It protracts the scapula. The origin is the second to fifth ribs, and the insertion is the coracoid process. This is the serratus anterior. It protracts the scapula and is used in punching and pushing. The origin is ribs 1 to 8 or 9, and the insertion is the scapula. This is the subclavius. It depresses the shoulder and clavicle moves inferior and anterior. The origin is the first rib, and the insertion is the clavicle. This is the trapezius. It retracts, rotates, elevates, and depresses the scapula and supports the weight of the arm. The origin is the external occipital protuberance and spinous processes of C7 to T12 vertebrae, and the insertion is the superior nuchal line, clavicle, and spine of the scapula. This is the rhomboid major. It retracts and elevates the scapula. The origin is the spinous processes of T2 to T5, and the insertion is the medial border of the scapula. This is the rhomboid minor. It retracts and elevates the scapula. The origin is the spinous process of C7 to T1, and the insertion is the medial border of the scapula. This is the levator scapulae. It lifts the scapula. The origin is the transverse processes of C1 to C4 vertebrae, and the insertion is the medial border of the scapula. This is the latissimus dorsi. It allows pulling and rowing. The origin is the vertebrae, iliac crest, scapula, and ribs. The insertion is the humerus. This is the deltoid. It is the prime mover of arm abduction and antagonist muscle in arm adduction. The origin is the clavicle acromion process in spine of the scapula, and the insertion is the humerus. This is the pectoralis major. It moves the humerus in flexion, medially, and adduction, and keeps shoulder in place. The origin is the clavicle, sternum, and ribs. The insertion is the humerus. This is the supraspinatus. It abducts arm at the shoulder. The origin is the supraspinous fossa, and the insertion is the humerus. This is the infraspinatus. It laterally rotates the humerus. The origin is the infraspinous fossa, and the insertion is the humerus. This is teres major. It adducts and medially rotates the humerus. The origin is the scapula, and the insertion is the humerus. This is the teres minor. It laterally rotates the humerus. The origin is the scapula, and the insertion is the humerus. This is the coracobrachialis. It flexes and adducts the arm. The origin is the coracoid process, and the insertion is the humerus. This is the subscapularis. It medially rotates the humerus. The origin is the subscapular fossa, and the insertion is the humerus.